Thanks very much, Chair. And again, thank you to the witnesses being here. Mr. Keon, I think we've heard some testimony that perhaps you could clarify or a question from Mr. Staples that medication costs might differ across the country. Could you tell us, is that true? And are there jurisdictions that have prices that are better than others in Canada?
Thank you for the question. Yeah, I should clarify. I'm here today representing the off-patent industry, the generic and biosimilar industry. We fill 75% of prescriptions for about 20% of the costs. So there's 80% of the costs that don't go through the companies that we represent here today. But as I've said twice already, we have a national system on pricing. Quebec participated in the latest round of negotiations for the first time. It is a national system. All provinces pay the same price. All payers in Canada pay the same price for generic medicines. And so when I say that we don't like bulk buying, I think we already have a national system that's negotiated with experts who run drug programs, leads to low prices. And that's what we want. We are concerned with terms like bulk buying if it implies that there's going to be some attempt to drive pricing down lower. Countries like New Zealand bulk buy. When we look at the data, they have fewer drugs available than elsewhere. And so that's not a system that we recommend. We have worked very hard with the PCPA, with the provinces, and the 3 federal drug plans to get a system, and we think that system should be respected.
Thank you very much for that. And through you, Chair, to the Parliamentary Budget Officer, one of the things that does concern me is the loss of coverage on behalf of all Canadians. And if you do some napkin-based math, perhaps this program was based on 1 million people. If 40 million people are, going to have to enter into this program, I mean, I can do the math in my head, but I'd like to perhaps hear you say it out loud with your credibility as the PBO. What would be the cost for simply these 2 classes of medications on the basis of 40 million Canadians?
That, unfortunately, I don't know off the top of my head. If all the
40 times the amount, would it not? I mean, is that not the math?
Lisa tells me that we have the numbers, so I'll probably let her speak. Sorry.
If you look at the table that we provide in our costing note, the very first line, the cost will amount to approximately $5.7 billion, would give you an estimation for these same drugs, if the program covered everyone in Canada, how much that would cost. And then you can see the cost recovery due to public plans or the private drug coverage. That's pretty much the cost recovery, what currently public and private plans cover.
Right, very good. But this, again, I don't have that table, or I can't find it right in front of me. But that being said, are you suggesting that public plans would continue to cover these medications because they're funded by provinces in that estimate, or are we suggesting that this is for all Canadians?
Well, the numbers that Lisa mentioned is the expenditures that are currently being covered by public, private, and out-of-pocket expenditures. So for the drugs under C64, contraceptives and diabetes, about $5.7 billion. So that's assuming that all these expenditures would be covered by the federal government. That's how much it would cost. And then we don't make any assumptions as to whether provinces would continue. Well, we assume they would continue because there's no sign that they will withdraw. But if they were to withdraw their coverage, then the federal price would go up, obviously.
Right. Great. Thanks for that. When we begin to look at this, I mean, this is a small fraction of medications out there. Certainly, that's not to say that the medications for diabetes and contraception are not important. Certainly they are. as a former family doctor, wrote lots of prescriptions for both of those medications. You know, maybe, and I know you don't have a crystal ball, Monsieur Giroux, but, you know, when we look at the costs of other medications that are currently coming down the pipeline, they're significantly more, often thousands or hundreds of thousands of dollars. And what might that look like? To me, that's a catastrophic number. 5.7 billion multiplied by hundreds of thousands. Is that a fair estimate?
Everybody needs these expensive drugs, fortunately. But it's true that generic drugs tend to be a relatively small portion of all prescriptions, but a much higher proportion of total expenditures. So you're right. When new drugs come onto market, they tend to be much more expensive than generic drugs, as I'm sure Mr. Keon will attest. So there's a potential for new drugs to push expenditures on drugs upwards.
Thank you, Mr. Giroux and Dr. Ellis.